Health claims and symbols on food packages are intended to help consumers identify foods that are healthier options, but little is known about their influence. Starting in 2012, researchers across Europe have come together in the CLYMBOL project to look at the effects of claims and symbols on consumer understanding, purchase and consumption behaviour. On June the 15th, 2016, CLYMBOL organised a public stakeholder conference to present the project results, put recommendations and suggested communication guidelines to vote, and discuss the role of claims and symbols with key European stakeholders. This video contains extracts of what the presenters and panel members said during the conference.
We do hope to inform guidelines of EU policy. We see that there is a revisions undertaking and we do want to provide information that is going to help.
Nutrition claims were found on 21% of the foods. Health claims were found on 11% of the investigated foods.
We're showing that foods that are carrying the claims are slightly healthier than the foods without health claims. Using a nutrient profile model like the Australian, New Zealand nutrient profile model would improve the nutritional quality, undoubtedly.
So what do they already know about the nutrients, and what they know will dictate how they categorise them. If it's something they're familiar with and have talked about and thought about, they might be able to categorise it in the way in line with the regulation.
Motivation was a much more important driver of use than ability. Motivation was driven by need for information, which in turn was driven by an interest in healthy eating. The path that might be most successful is clearly a path from stimulating consumers' interest in healthy eating first of all. This may drive need for information and in turn may make people more motivated to deal with health claims.
So it shows that the measure of attention, which eye tracking is a predictor of the choice.
The strongest result we find is that if consumers can understand claims, if claims are simple, if claims relate to the mental schemes that Monique talked about, that increases clarity and that increases attractiveness of the communication. So the minute the claims become more difficult, it's also more likely that they will make inferences which are not justified. But the fact that health claims have an effect in situations where the health goal is active and that effect is really limited when that health goal is not active.
The familiar nutrient, the familiar function, but the unfamiliar combination. This was our vitamin C and tautness of the skin slogan. They showed more interest than they were confronted with the extremely familiar combination.
CLYMBOL project is indeed providing some very, very helpful information. It's actually the first of its kind looking specifically at consumer understanding in terms of nutrition and health claims and symbols used in this context.
And I think in that regard, we really have to push more to improve health literacy, making people more familiar with the unfamiliar things in nutrition and making sure that people have nutrition education at the very early stages of life.
But we need to make sure that if claims are used, then they do not mislead consumers.
And the evidence from CLYMBOL is that it's extremely difficult to get a claim that is going to work for all. The law is only as good as the science behind it.
We can improve the role of health claims. We can by optimizing their relevance, optimizing their understandability, tailoring them to specific consumer groups where they may be especially relevant, we can probably contribute to that health claims have a function both from a public health perspective and also from a commercial perspective.
CLYMBOL finished in August 2016. More information about the project's results and publications is available on the website clymbol.eu.